Today is May 20th, 2025. Around the world, we are witnessing a concerning resurgence of COVID-19. Though the pandemic has long faded from the headlines in many countries, the virus has not disappeared. Instead, it has evolved, subtly, silently, finding new pathways to spread and reassert itself in populations that have, for the most part, returned to normalcy. This return to normalcy, while comforting, may have come at a price. In Southeast Asia, the rise in cases has been most pronounced. Singapore, Hong Kong, parts of China, and Thailand are now reporting a noticeable increase in weekly infections. Singapore, often considered a benchmark for meticulous pandemic response, recently saw an uptick of 28% in weekly COVID-19 cases. From April 28 to May 4 alone, over 14,000 new infections were documented. For a country of its size and population, this is a significant indicator. These numbers do not yet translate into overwhelmed hospitals, but they serve as a stark reminder. COVID-19 is not over. The dominant strain now in circulation is JN.1, a descendant of the Omicron lineage. Alongside it, a new subvariant LP.8.1 is under close watch by virologists and health agencies. These subvariants appear to possess greater immune evasion capabilities, allowing them to spread even in populations with prior infections or high vaccination coverage. While disease severity remains largely mild to moderate, the high transmissibility poses a significant risk for vulnerable populations, the elderly, immunocompromised, and those with underlying conditions. In Hong Kong, over 1,000 cases were reported in the week ending May 10, marking the highest positivity rate since the beginning of 2024. Officials are ramping up testing and reminding the public to take basic precautions, such as masking in enclosed spaces and testing when symptomatic. Though restrictions have not returned, public messaging has clearly shifted from post-pandemic to ongoing vigilance. In India, meanwhile, there are reports of a mild but notable increase in cases. As of May 19, there were more than 250 active infections, mostly in the states of Kerala, Maharashtra, and Tamil Nadu. While these cases are classified as mild, they serve as early signals of a potential wave that could expand across other regions in the coming weeks. The Ministry of Health is monitoring the situation and has advised citizens to resume voluntary masking in crowded areas. What explains this new surge? The answer lies in a confluence of factors. Firstly, the evolution of the virus itself. COVID-19, like other coronaviruses, mutates regularly. The Omicron variant introduced an entirely new paradigm of rapid transmission, and its descendants have refined that model. Each new subvariant acquires subtle mutations that enhance its ability to bind to human cells, evade immune memory, or replicate more efficiently. Even if these changes do not cause more severe illness, their cumulative effect is increased spread. Secondly, there is the matter of waning immunity. Most people received their last vaccine booster over a year ago. While vaccines remain remarkably effective at preventing severe disease and death, their ability to prevent infection declines over time. The result is a population that, while largely protected from the worst outcomes, is once again susceptible to catching and spreading the virus. Third, and perhaps most importantly, is behavioral fatigue. In many countries, COVID-19 is viewed as a historical event, something that happened, rather than something still happening. Mask usage has plummeted, ventilation standards have relaxed, and large indoor gatherings have resumed at pre-pandemic levels. Human beings crave normalcy, and societies tend to move forward. But viruses, as we've learned, do not respect our timelines. The implications of this resurgence are multifaceted. Healthcare systems must remain agile. Hospitals are not currently overwhelmed, but seasonal increases in respiratory viruses, including influenza and RSV, may compound pressure on emergency rooms. Particularly in regions with aging populations, even a small rise in COVID-19 cases can lead to increased hospital admissions, especially among those with comorbidities. In the scientific community, there is renewed focus on vaccine reformulation. The WHO has issued guidance to vaccine manufacturers to update their formulas to match current circulating strains. In the United States, the FDA has recently authorized the use of Novavax's updated protein-based vaccine for seniors and at-risk individuals. This vaccine offers a non-mRNA alternative and has shown promising immunogenicity against recent variants. Attention is also turning to long COVID. Though daily headlines no longer speak of it, millions globally continue to experience persistent symptoms: fatigue, brain fog, cardiovascular complications, and more. Long COVID remains a public health puzzle. Studies from major research institutions are examining the role of chronic inflammation, immune dysregulation, and even viral persistence as potential mechanisms. Promising therapeutic targets include anti-inflammatory agents like baricitinib and newly investigated immunomodulators aimed at restoring immune balance. Historically, resurgences are not new. After the 1918 influenza pandemic, there were multiple waves over several years. Public fatigue followed by viral evolution created periodic returns of infection. The difference today lies in our tools: vaccines, genomic surveillance, real-time data, and global collaboration. However, these tools are only effective if used, and used early. The resurgence also raises questions about public health infrastructure. Countries with robust healthcare systems and coordinated public health messaging are more likely to respond swiftly and contain spread. But disparities remain. Low-income countries continue to struggle with vaccine distribution, genomic tracking, and access to antiviral treatments. A pandemic, by definition, is global, but our capacity to respond is still fragmented along geopolitical and economic lines. There is growing momentum behind the WHO's new pandemic preparedness framework, informally called the Pandemic Agreement. While still under negotiation, its core mission is clear: prevent the next pandemic by sharing data, resources, and knowledge. COVID-19 revealed the cracks in our global health armor. The goal now is to repair those fractures before the next crisis arrives. For individuals, the call to action is simple yet vital. Get vaccinated if eligible, especially with updated boosters. Mask when in crowded indoor spaces, particularly in areas with rising case numbers. Test when symptomatic, and stay home if unwell. These small actions, repeated by millions, can reduce transmission and protect the most vulnerable. To conclude, the current global resurgence of COVID-19 is not a cause for panic, but it is a call for renewed attention. The virus remains among us, adaptable, persistent, and always evolving. It demands from us not fear, but respect. Respect for science, for public health, and for one another. As we continue to navigate this post-pandemic era, let us remain vigilant, compassionate, and informed. Thank you for tuning in to Infection Navigator. As always, we'll continue to monitor the global health landscape and bring you the most accurate, nuanced, and timely updates. Stay safe, stay thoughtful, and stay prepared.